Hi, this is going to be a video on the lumbar vertebra. First, we are going to talk about the lumbar vertebra. There are 5 lumbar vertebra, L1 to L5. Of them, the first 4 are typical, and the last one is an atypical vertebra. This is a typical lumbar vertebra. It has a body which has a transverse diameter greater than the anteroposterior diameter. It has superior articular processes, inferior articular processes, the transverse processes, the spinous process, and that's about all. How do we differentiate a lumbar vertebra? It doesn't have any costal facets on its body. The pedicels, which are this portion connecting the body to the transverse processes, this is the pedicel. The pedicels are located more superiorly on the body. So the superior vertebral notches, which is this notch, this one is actually shallow than the inferior vertebral notch, which is this one. And there's another differentiating feature, that the distance between the two superior articular processes is actually a lot more than the distance between the inferior articular processes. This is an atypical vertebra. The body of this vertebra is a lot bigger than the typical lumbar vertebra. The superior articular processes, as you can see, are spaced nearly equally compared to the inferior articular processes. The transverse process of the atypical vertebra encroaches a bit on the body as well. It is attached to the base of the pedicel and it encroaches on the body as well. That's about all of the features that differentiate a typical from an atypical vertebra. Now we'll come to the muscle attachments and to the ligament attachments to the vertebra. This anterior portion of the body, of the upper border, the body and the lower border, will provide attachment to the anterior longitudinal ligament. Posteriorly, we will have a posterior longitudinal ligament. Now, just behind the attachment of the anterior longitudinal ligament, we have the attachment of the right crus of the diaphragm on the right side and the left crus on the left side. The right crus of the diaphragm is attached to the vertebra L1, L2 and L3, whereas the left crus is attached only to L1 and L2. Behind that, we have a very extensive attachment of the psoas major muscle, which extends on the transverse process as well. The laminae of the vertebra, which are these broad plates of bone, these provide attachment to the ligamentum flavum on their anterior surfaces. The spinous process, which as you can see is not, if we hold the vertebra horizontally, it's not projecting downwards, it's more horizontal in its position. The posterior and inferior portions of the spinous process are thickened, and the spine will provide attachment to 3 structures. It will provide attachment to the posterior layer of the thoracolumbar fascia. It will also provide attachment to the erector spinae muscle, the multifidus muscle, the interspinous muscle, and it will also provide attachment to the interspinous and supraspinous ligaments. Then we come to the transverse process. The tip of the transverse process will provide attachment to the middle layer of the thoracolumbar fascia. The vertical ridge, there is a vertical ridge or an area on the anterior surface of the transverse process, and this will provide attachment to the anterior layer of the thoracolumbar fascia. Medial to this ridge, we have the extensive attachment of the psoas major, and lateral to this, we have the attachment of the quadratus lumborum muscle, which is I have marked it a bit here. The upper and the lower borders of the transverse process provide attachment to the lateral intertransverse muscle, whereas we also have an accessory transverse process. This develops from the true transverse element of the embryo's vertebra, and this will provide attachment to the medial intertransverse muscle. The posterior portion of the superior articular process is thickened and it forms a mammillary process. The mammillary process, as well as the accessory transverse process, will provide attachment to the medial intertransverse muscle. Extending onto the mammillary process will be the attachment of the multifidus, which also attached to the spine. Passing through the vertebral canal will be the spinal cord. Through the vertebral canal of the first lumbar vertebra, this is known as the conus medullaris, whereas in the lower 4 vertebra, this is known as the cauda equina. The transverse process of the first lumbar vertebra will also provide attachment to the arcuate ligaments of the diaphragm, whereas the transverse process of the 5th lumbar vertebra, which is here, will provide attachment to the iliolumbar ligament. That I guess is all about the lumbar vertebra. I hope you enjoyed learning about them. Thank you.